Hello, everyone. My name is Sierra Caffey, and today I'll be talking about leprosy. Thank you all for coming, and I hope you can spread awareness about leprosy. Thank you. Each year, approximately 200,000 new cases of leprosy are reported worldwide. The United States has approximately 225 new cases annually. India has the highest number of cases annually, gaining around two-thirds of the new leprosy cases. Brazil is the second highest, followed by Indonesia. Other countries with a high number of cases annually are Nepal, Madagascar, and Tanzania. This picture helps to show which countries have the highest amount. Leprosy is primarily transmitted through prolonged close contact with an infected person. The bacteria that causes leprosy is Mycobacterium leprae. The bacteria is spread through respiratory droplets when an infected person coughs or sneezes. If you breathe in these droplets over an extended period of time, you may become infected. Also, close contact with an infected person's nasal secretions can also transmit the bacteria. Leprosy is not highly contagious though. Most people have a natural immunity to the bacteria, and it usually requires months of close untreated contact to contract the disease. Casual contact with the person is not likely to spread the disease. Leprosy is influenced by several genetic factors that affect an individual's susceptibility to the disease. Variations in genes involved in the immune system play a significant role impacting how the body responds to the bacteria. The human 45 antigen, also known as the HLA system, which helps the immune system to distinguish between the body's own proteins and from the pathogens, is also implicated, with certain HLA genes associated with either increased susceptibility or resistance to leprosy. Additionally, other non-HLA genes involved in various immune response pathways have been identified as influencing the risk of developing leprosy. The specific genetic makeup of an individual can also determine the form of leprosy they develop, ranging from the less severe paucibacillary form to the more severe multibacterial form. These genetic factors combined with environmental influence and pathogen exposure contribute to whether an individual is exposed to Mycobacterium leprae will develop leprosy and how the disease will manifest. Leprosy is influenced by several location-related factors. It is more prevalent in tropical and subtropical regions, particularly in parts of Asia, Africa, and Latin America. Poor sanitation and overcrowded living conditions can increase the likelihood of transmission, as extended exposure to the environment where leprosy thrives contributes to higher infection rates. Areas with high poverty levels often have inadequate health care and living conditions, which can increase the spread of leprosy. Living in close proximity to untreated individuals with leprosy increases the risk of transmission. Leprosy primarily affects the skin, nerves, and mucous membranes. The skin symptoms of leprosy include but are not limited to discolored or lighter patches of skin that may be numb, thick, stiff, or dry skin, and nodules or lumps on the skin. Also, individuals may develop painless ulcers on the soles of their feet, painless swelling, or in lumps on the face or ear lobes, and experience loss of eyebrows or eyelashes. These symptoms can vary in severity and may take several years to appear after the initial infection. Leprosy can significantly affect the nerves, leading to various symptoms. These nerve-related symptoms include numbness or loss of sensation in the affected areas of the skin, muscle weakness, or paralysis, especially in the hands and feet, and enlarged peripheral nerves, typically around the elbow, knees, and sides of the neck. Additionally, individuals may experience pain and tenderness in the affected area, loss of reflexes, and deformities in the hands and feet, such as curling of the fingers and toes. Vision problems, including blindness, can also occur due to nerve damage. Early detection and prompt treatment are crucial to prevent further nerve damage. While some nerve functions may be restored with early and appropriate treatment, complete reversal of the nerve damage is often not possible, particularly in advanced cases. Rehabilitation and physical therapy can help manage symptoms and improve quality of life for those affected. Leprosy can manifest in various parts of the body, including the nasal passages. Common nasal symptoms include nasal congestion or obstruction, which occurs when the mucous membrane within the nasal passage becomes inflamed or swollen. Additionally, individuals may experience chronic nasal discharge, which can range from clear to pus-like. Frequent nosebleeds are another symptom resulting from inflammation and damage to the nasal tissue. Leprosy can be treated with a mixture of antibiotics through a regimen known as multi-drug therapy. The World Health Organization recommends using a combination of dapsone, rifampicin, and clorbamicin for the treatment of leprosy. This combination helps to prevent the development of antibiotic resistance and effectively treats the infection. The treatment duration typically ranges from 6 months to a year, depending on the severity of the disease. Spreading awareness about leprosy is important in preventing its spread. By informing people about the early signs of leprosy, individuals are more likely to seek medical help quickly, which has the potential to prevent the disease from progressing and reduce the risk of transmission. Additionally, awareness efforts help to reduce the social stigma and discrimination associated with leprosy, encouraging those affected to seek treatment without fear. Public health initiatives such as vaccination programs and the distribution of multi-drug therapy also benefit from increased awareness and support. Furthermore, informed communities are more likely to support affected individuals, helping them integrate into society and access necessary healthcare services. Overall, raising awareness fosters a more informed and compassionate society that actively works towards the eradication of leprosy. Early diagnosis and regular checkups are extremely important in preventing the spread and progression of leprosy. Early detection allows for immediate treatment, which can halt the disease before it causes significant damage or disability. By identifying and treating leprosy in its initial stage, the risk of transmission to others is significantly reduced. Regular checkups ensure that any recurrence or complications are detected early, allowing for timely intervention. An active approach helps in managing the disease more effectively and reduces the stigma associated with visible deformities and disabilities caused by advanced leprosy. Overall, early diagnosis and regular monitoring are key strategies in controlling and eventually eradicating leprosy. There is a vaccine for leprosy. The Bacillus calmette-guerin vaccine, originally developed for tuberculosis, has been shown to offer some protection against leprosy, with efficiency ranging from 18 to 90%. Also, a more specific vaccine called LepVax is currently in development. LepVax has completed phase 1A clinical trials and is moving into further trials to assess its effectiveness and safety. This vaccine aims to provide long-term protection against leprosy and reduce transmission rates. Reconstructive surgery and neurosurgery play significant roles in managing the complications of leprosy. Reconstructive surgery aims to restore functions and form to affected areas, preventing further disabilities and facilitating rehabilitation. Common procedures include correcting deformities such as claw hand, foot drop, and eyelid paralysis. These surgeries help improve the patient's ability to perform daily activities and enhance their quality of life. Neural surgery, particularly decompressive surgery, addresses nerve damage caused by leprosy. This type of surgery can relieve pressure on affected nerves, potentially reducing pain and preventing further nerve damage. While the effectiveness of decompressive surgery compared to steroid treatment alone is still debated, it can provide immediate relief and improve nerve function in some cases. Overall, these surgical interventions are crucial for reducing the physical and social impact of leprosy, helping patients regain their independence and reducing the stigma associated with the disease. Listed below are my references, and thank you for listening and learning about leprosy. Have a great rest of your day.